And we are live.
Okay. Hi, Salil. Good to meet you. Good to meet you online. Different from the times that we had meetings in Mumbai, but I suppose this is the new normal that you are talking about in your session.
Yeah, quite like that. Yeah, it's good to see each other over the screen, although it feels a little odd because we've always
Yeah.
met face to face. But anyway, it's good to talk to you because I don't think we would have met under other circumstances.
Right. Right. So I think there was a very good response for your sessions, and you covered a whole range of subjects. So I'm sure that people have a very good understanding of the concepts that you discussed and the theory part of it. And I thought that in this session we will look more about practical things that they will need to do. So you spoke something about the need of the right mindset for pharma to bring about a digital transformation, which requires a lot of willingness to experiment, fail, and or fail fast, as they say, and agile learning instead of the incremental changes to the broken model. So I was thinking that it would be good if you could elaborate a little bit on what does it mean in practice, to take these steps of trying to experiment, to fail, and learn from that, and uh, get on the get on the task of digital transformation or even adoption. What does it mean in practice? What do the pharma people need to do?
Okay, so thank you. That's an interesting question and a good way to start. But before I answer the question, I want to thank CredoWeb and Medicine Man for this opportunity. Thank you for setting up these sessions because I think this is another platform through which many pharmaceutical professionals, especially youngsters, are getting some access to to listening to very senior people in the industry like Mr. Hariram and Deep Bhandari and yourself. And I'm sure that we've just started, and I think going forward there will be many more opportunities for executives to address these people. So I think it's creating a lot of good content for young pharma professionals, and I want to place my congratulations on record. So having said that, I think pharma is at a very at a cusp of great change. So it's at a cusp of great opportunity or a cusp of wasting away that opportunity. So it depends on how people look at it. I think the whole environment that we are existing in, the which has been done by the the disaster that has happened because of the corona pandemic, has at some point allowed businesses to take a halt and reimagine. So some businesses that are, I mean, different businesses are looking at it in different ways. Some companies are thinking about how this is a problem and how we are actually losing out on business opportunities, and they're waiting for things to go back to normal and kind of go rushing back into the field and to see the customers and continue life as normal, while some of the other ones are taking time to reflect and to reimagine the scenario. So there have been certain micro environmental shifts which are allowing or are creating a lot of positive vibes to help us understand that the environment is actually ripe for change. So if you look at the way regulators and governments around the world have eased up, or the degree of leniency that you're seeing with regulators around the world, it is quite unprecedented in its nature. We just heard that remdesivir got approved for use in India without a single major clinical trial. And
That's
that would never have happened in ordinary circumstances. So while people see that to be a major problem, I look at it as an opportunity, because if regulators are easing up, and if there is leniency from their side, I think it's a very opportune moment to usher in transformational change. Because one of the biggest barriers to transformational change is our regulations, which and for technology especially, that's been a long case, because technology evolves in such a way that it always leaves regulators far behind, right? So regulations are always lagging up on, and they're catching up with technology. Society per se is catching up with technology. So these changes, and here is a situation where regulations are, or regulators are looking at these environmental changes as a need to kind of bring a certain degree of pragmatism into their thought process, and they're not being dogmatic. They're moving away from their dogma, which is not, you don't see these kind of things often. So this is a nice opportunity for pharma to kind of think about how they can reimagine their connect with their customers, how they can reimagine with the whole process of go to market, and look at technology, because I think the best use of technology is essentially where you have identified inefficient processes within your organization, and
Absolutely.
those processes are you have a chance to either to change those processes or bring in a certain degree of efficiency, whereby the capital that is involved, or your working capital is kind of utilized in a very nice way, or you simply keep throwing more money after bad. Right. So the old commercial model in pharma being broken, or coming to a strain, it really hadn't changed in about 4 or 5 decades, because ever since I entered the pharma industry in 1994, I had been asking senior colleagues around, how things were in the past and how things were in the different, and current, and throughout those years, we really didn't get too much of an answer about how things had changed. So more or less we were doing the same thing again and again, probably bringing in incremental innovation, or bringing in incremental changes. I wouldn't say innovation, but things like the visual aid came in, and then things like how do you use laptops to deliver that visual aid better? How do you bring in iPads to deliver that better? So there were cases of how companies thought about using technology to bring in some level of efficiency. But the problem is that didn't really look like a transformation. So what finally product managers ended up doing is taking the easy way out, okay, and simply making a PDF of the printed visual aid and putting it on iPad. So that's more like paper on glass. That's not really an innovation, or that's not really any different. And that's the problem, and sometimes that really didn't work. Now, when that didn't work, the easiest scapegoat to blame was digital, and it was easy to say that technology doesn't work or digital doesn't work. So what is required right now, I think, is how companies can identify their go-to-market strategy, look at inefficiencies that have crept into that go-to-market strategy, and then think about how to use technology to bring in that level of efficiency. One last comment is that I think pharma has done phenomenally well in adopting technology to make its own processes better. So you see a lot of use of robotics, AI, blockchain, and all of this to kind of improve their drug discovery process, the distribution process, the clinical trial process, and how they've kind of mopped up the distribution chain. So bringing product from factory to pharmacy, yeah, all those kind of things, they have actually done well in terms of digitalization. But what unfortunately has not happened is those positive thinking frameworks have not migrated beyond the factory, or not migrated beyond the inside of a pharmaceutical company, to redefine the way pharma operates with its customers.
So even in your session, you said that this kind of a situation has never been there, where there has been a complete halt. For example, pharma has adopted some form of digital even in marketing, but it has not been to the exclusion of the field force going, but as a kind of as kind of one more channel that where they probably have not given as much emphasis as they should have given. Come to think of it, there is always an opportunity to use digital even in the last mile, because Indian pharma has one of the highest attrition rates. So that could have been the opportunity when the territory is idle for a month, 2 months, sometimes 6 months. Pharma could have really tried to use the digital channels to keep some amount of connect, at least with the key customers.
Agreed.
So at least now they should realize that it's going forward, yes, the phygital looks to be the most feasible model when the situation hopefully gets to normal, which is the new normal. But I think they should also factor in things like attrition and a territory being left vacant. The new person, when he comes in, he has got a lot of inertia to go against, which all can be I think in many way addressed by adopting digital and keeping some kind of a digital connection open, which is available to the frontline manager, who, in the absence of the rep being there. So, what are your thoughts on ways in which they can adapt, even if you say call it incrementally, where they can really begin to tinker around with the digital? What are the first or the easiest ways to get small wins where they can adapt digital?
I think that's an interesting example, where there is attrition, and what we've seen is in pharma companies, attrition levels are pretty high, or at least used to be pretty high, right? So anything between 17 to 25%, sometimes 30%. So when you have that level of vacancies in territories and all those things, I agree. I mean, digital could have been a good tool, but what is the issue over there is that I don't think pharma actually intends to keep those territories vacant for long, and therefore I think while the carryover rate of the brand continues, they are able to quite quickly fill in this one, because there are opportunities, there is always a willing person who will be hopping on from one company to the other and very quickly fill in that. That's the easiest way out. But to extend that point, some of the suggestions that we've given to our clients are on using digital to promote tail end brands. Some companies have, because of the size of the portfolio and the number of SKUs that are available, very quickly strategic focus moves away from some of the older molecules towards newers. And new product introductions has traditionally been one of the fortes of Indian pharma, right? The speed with which they bring new molecules to market. Now, if that focus is always on bringing new products to market, there's a long tail of products that doesn't have any FTE or does not have any resources allocated to it. But some of those brands, they still have juice. They still have promotional. They are promotional sensitive, and therefore those are products, or that is a portfolio that is very well suited for digital promotion. You can do a total non-rep model, right? And if you want to experiment a non-rep model and do it, that's the best way to do it. Why not? So all you have to do is do a multi-channel program using your content that you've created over all the years for that product, which you are not using today, and create a multi-channel engagement which can at least bring about a basal level of promotion for those brands. And I don't think it is very far-fetched to imagine that such brands will very quickly kick back into a growth mode. There are a couple of companies that I know of which have thought about doing this. I don't know if they are actually doing it and what the outcome is, but there are a couple of companies which were positive to the idea. But most of the companies seem to think that you're talking about a portfolio that doesn't interest me. That's not part of my target. That's not part of my sales budgets, and therefore I really have I'm not really interested in that. So again, it's an opportunity that we have let go by. But and even in areas where pharma has actually thought about using digital, we have done that in piecemeal, right? So while we may have a social media page here, or an iPad campaign there, or a webinar here, or a CME there, most of it is, these are random acts of digital. And random acts of digital typically are, they don't really throw back enough return, or you're not able to kind of judge the impact of those activities on the brand in the long term. And from that perspective, sometimes digital comes across as a nice to do experiment, but really doesn't find itself to get accommodated in the mainstream of strategy. So from that perspective, I think that random acts of digital are always carried out, and so pharma really doesn't have a use case where they've used up digital in a very coherent manner, or they have a very coherent strategy behind getting an objective, or driving an objective. And therefore, yeah, they are still kind of, we're not very sure about whether it works or it doesn't work. Because most of the sessions that I do, or whenever I'm talking to people from the industry, the typical questions are around, what are the KPIs? How do I measure ROI? What are the kind of things that I should, what are the metrics that we should do? Most of, I get pushback from my seniors in the organization because I'm not able to show them an ROI capture model, etc. So my pushback to that is, I don't think pharma traditionally has ever been an ROI focused industry. Because I don't think we know what is the return on investment on all the huge amount of money that you pour into these medical conferences, or all the work, all the printed material that is created throughout the year, or the money that you give to advertising agencies, or whatever, all the marketing spend that happens. I don't think we really track its use, or we understand what the return comes from, and what is a better channel. And I don't think we've done those kind of studies. So it's very intuitive. Our understanding is very intuitive. As long as the brand is growing, we assume that our investments into those into marketing is on the right track, and we are kind of happy to exist at a very broad, superficial level of marketing. Now, this is also creating an issue. So one is to worry about the ROI. The other is to measure multi-channel engagement through single-channel metrics. Now, the way we are measuring our marketing campaigns is purely on how many new prescriptions did I get because of this campaign, what is the growth in the market share that I did, what sort of growth is my brand growing outside of the market, it is outperforming the market, or is it not outperforming the market. We look at very broad numbers like that. Those I don't think are the right metrics to measure even for an offline campaign, right? Because you're not, at best you can correlate. I don't think you can create causation there. And you really cannot prove that it's because of this intervention that this growth rate happened, or this share came, or all of that. Now, faulty metrics, or at least incomplete metrics, I might not say faulty, but there may be incomplete metrics to measure. Using those incomplete metrics to a completely new multi-channel entry, multi-channel campaign, is wrong on so many fronts, and it's not going to give you the desired results. So again, we end up, in that vicious loop of either not understanding how to measure marketing activity, and then applying the wrong metrics or the incomplete metrics to a completely new form of marketing, and then declaring that this simply does not work. Now that's one part of it. I think another part of it is to simply say that we just have to do digital because every other competitor is doing it, right? So senior executives, when we are talking about digital today, until March, everybody that I was talking to in the industry kept telling me that digital is the future. Okay, and suddenly in the second half of March, everybody wanted to do it on Monday morning. But it wasn't because they understood the importance of digital, or they understood that this is a medium through which they can reach out to customers and create more efficient models of interaction or anything like that. I think it's simply because they had no choice. So even today, pharma is pushing itself hard towards adopting a new way of interacting with their customers, with a little bit of a lack of conviction, if I might call it so. Given half a chance, I'm 100% sure that markets will, if markets open up, everybody is simply going to drop all of this and go back into doing what they were doing earlier. So this usage of this time in reimagining their relationships, or reimagining how you can actually create value for customers in a different way, is probably a missed opportunity, in my opinion. I'm still not very I'm not pessimistic about this. I really think that there are companies which are considering this with a great deal of care, but moving with a speed which could be improved. That's, although management may be convinced and they may have the intent to kind of do it, there are too many factors to manage, which will, the organizational structure, the mindset of the people, the willingness and the capability to manage a multi-channel campaign, the capability of the field force to manage, multiple messaging going out, the application of a closed loop marketing platform that allows the rep to kind of plan his own call versus the promo grid that is given in the cycle meeting. This requires an entirely different change in the way that is done. And decentralization of power is one of the defining factors of technology. How comfortable we are sitting in HO to kind of give away that power and tell the rep that you are smart enough to pick this up and formulate your own call is probably a mountain that we still have to scale.
Yeah. I think in many ways it's like the challenge that doctors are facing when customers search Google and come with their own versions of what is wrong with them. There is so much of pushback from the doctor. Just today, I saw on Twitter that a doctor was saying that don't Google for your own symptoms, because if you search for headache, it might throw that suggestion that you have brain tumor.
Yeah.
So there is a kind of a loss of a sense of loss of power among many doctors, that patient is, instead of guiding the patient to search the net in a more intelligent way, so that he is able to make out between authentic sources and sources which may not be authentic. I think the general suggestion is don't search the internet. So in the same way, I think what the digital does is that it can make the rep a really an empowered person who now can because he has the best understanding of the territory, and he has the best understanding of the customers, their timings, their preferences. So he can use the digital multi-channels to actually connect with the customers based on their preferences. And I'm sure that there are ways in which marketing can guide them. So I think that's one of the challenges, is that how do you give the power to the bottom of the pyramid instead of it all being stored up in the top of the pyramid.
Yeah, so one of the jokes that used to do the round is that if you Google any of your symptoms, it could be a toenail fungus, right? Anything as mundane as toenail fungus or a headache, it finally leads to cancer. Okay, Google will convince you that you have cancer of some type. So I think this has a lot to do with the maturity of people who use this technology, and the capability, the maturity of the people, plus the alternatives that are available, or the content pieces that can corroborate each of these things, right? So most people make their decisions and judgments based on one piece of article, one content, one piece of content that they consume. And so patients, I think, are equally to blame, because doctors get upset because patients come with very strange questions. They don't understand that they have to read a lot more, that there are many angles to it, and they don't research thoroughly. They just read up a couple of pieces and come back and start questioning the knowledge of the doctor, and that can obviously irritate the doctor. To pull that analogy and extend it to pharma, the same kind of thing might happen from a rep. If a field colleague is not fully aware of or fully matured enough to understand how to manage all the multiple facets of customer engagement, it could be something that will not work out. And I think pharma is kind of very paranoid about that part of the customer engagement going wrong, because they've depended on the rep and depending on that part of the organization to be the front and center of everything, of managing the entire customer relations, right? So if the rep is distracted, or if the rep is confused, or is unable to understand how to manage the whole all the knowledge or the information that suddenly becomes available to him, it could lead to a negative consequence. But I think in that is opportunity. Right? How do you progress? How do you go to the next orbit? How can you move your current field force from a brand based selling model to a consultative selling model? How can you manage to help this rep capitalize on the relationship that he has? And I think that's one of pharma's greatest advantages. The greatest advantage is that pharma has a relationship with their customers. Many other industries don't have this, and that is something that, instead of looking down upon that or deteriorating that existing relationship, I think companies must think about how to augment it. And I'm sure they're doing this, right? But it all has to fall into place in a very sequential, in a very synchronous way. I think that's where we miss out. If the objective, our L&D teams or HR teams within organizations really thinking or working together with marketing and sales to ensure that their capability building at the rep level or various levels in the hierarchy are happening? Okay, are they reimagining the hierarchy to think that we should have a leaner and a meaner structure within the organization, whereby the Chinese whisper doesn't get activated. Okay, so there are many ways to do this, and that's one of the reasons why all digital transformation literature, anybody you listen to who is talking about digital transformation, always says that it has to come from the top. It has to come from leadership, from the C-suite. Okay, and leadership has a very unparalleled vision of how they would like to lead the organization, and I think it is their guidance and their interest and attention paid to all these kind of things that will eventually lead to functional heads within the organization realigning their objectives and kind of thinking as one. So I was recently asked a couple of days in one of these industry webinars that I was doing. They said, people asked me, how do you define or how does digital success look like? So I think in a sentence, there are many facets to it, but in a sentence, I think a digitally aligned organization or a digitally matured organization is where an entire organization comes together as one and focuses on the customer, on creating value to the customer. Now, it might seem very philosophical to say this, but there is a huge level of, I can see at least 2 years worth of work that goes into aligning an organization which is driven by silos, driven by personal agendas, driven by politics, driven by each functional head driving his own agenda and all those things, and kind of changing mindsets over there, making everybody start to look outward towards the patient and or the doctor, and saying that every little thing that you do is to ease the pain points in the journey of this customer. That's a phenomenal transformation, and if pharma were to do this, I mean, I would be the proudest uh, in the industry.
So, questions that has been asked on your after your session as well as Mr. Hariram's session is that there is a perception that digital is a very expensive proposition that is suited for large companies. So, what are your thoughts on digital adoption by smaller companies? There are thousands of Indian pharma companies that are, not very large. They might have a field force of 100 to 500, and so they don't have the legacy or the burden that larger companies have, and they may be even restricted to certain geographies of maybe south or east based. So how do you look at digital empowering these companies or enabling these companies to become the next large companies? Because when I joined the industry back in the 80s, Sun Pharma was not really a very big company. We had companies like Burroughs Wellcome and Ron Pauling, May and Baker, and these were the dominating, which people are probably not even don't even hear about those companies. So
Sarabhai Chemicals.
yeah. So I think there is an opportunity in this for the smaller companies to emerge as the next big player, the next mankind, if I should so say, using digital technologies to really expand their footprints across the country, expand their coverage. Because as of now, the coverage is entirely dependent on your ability to invest in expanding your field force. And digital might be a one-time investment. But it enables you to add more doctors, add more territories in a much more easier way than. So what are your thoughts on the smaller companies, because there's a large number of those companies of their adopting digital strategies?
I think the answer lies within the question, right? I think it is about digital being a resource liberator, and that is something that people need to understand, that digital allows you to liberate resources and reach scale which is unimaginable, which you cannot do in an offline world. If you understand the concept that digital is a resource liberator, then that answers the question of whether going digital is actually an expensive prospect. Okay, is that something that we will not be able to afford? We are small companies, we are less than 500 crores, and it's very difficult for us to do it. Digital is only for those companies with deep pockets and all. I think that's a myth. I think it all depends upon that's the wrong way to approach the problem. And I think the problem statement should be defined not by what I can do or what I can't do, but what do I need to do to stay relevant with the customer. And if I am looking at it from a customer's perspective, and I'm thinking about the fact that, I am an organization which is able to reach out to, say, 75% of my universe, but I would do well by reaching out to 100% of the universe. And that's all that I have to focus on. Right? That's all I have to focus on. Now, it's a myth that you have to do digital at a very, very high scale. Okay, I don't think large trillion-dollar organizations like Google or Amazon or Facebook started out trying to be trillion-dollar organizations. It is about taking baby steps. It's about taking one day at a time, one baby step at a time, trying to achieve whatever is the objective that you have to take the company to the next stage. So if your company is a new one and you really don't have too much of awareness about the organization with customers, then focus on that. How can you create awareness with about your customer, about your company with customers and lay people, right? Customers defined as doctors and patients, but customers and lay people. How can you do that? Now, an alternative is, I mean, one way to do this is to have an expansive field force, a very high degree of field force. So about 6,000 reps to 8,000 reps or something like that, which covers every nook and corner of the country, meets every doctor sitting with a red light, and kind of basically creates awareness about my organization. Another way to do this is to go the traditional media plan route, right? You invest in advertising, you invest in creating, so the kind of work that Mankind is doing. Okay, creating a huge level of public opinion around the products that they are doing, positioning themselves as a company that produces affordable medicines at high quality, which is a great work. I mean, they are doing a great job. Now, compared to that, digital costs you nothing. If you compare it to hiring 6,000 people or doing a media plan or something of that sort, it costs you nothing. Okay. So if your objective is to be able to reach out to 5,000 doctors or 10,000 doctors, which is the universe, if you're a specialized organization and you want to create this, it hardly takes you any money to do this. Okay, and it's not like there are companies which are not doing this, right? So a medium-sized company that I have had the good fortune of knowing the owner of that company, they have been doing something as basic as using WhatsApp to reach out to their doctors. Okay, and it's almost a free enterprise. The cost of it is zero. All you have to do is create doctor groups on WhatsApp and allow the rep to be the administrator and kind of engage those guys and do a case study discussion or a CME, or simply let them discuss. Bring 10 doctors together, have one KOL to manage that group, and simply let them discuss. There's nothing that you have to do. No content you have to create. No administration charges. You don't have to pay a platform or anything like that. So a very simple zero cost approach like this has helped that organization to achieve a great level of clarity amongst their customer groups. So they had a very well defined objective, very well thought out objective, very clear that this is what we want to do, and then they looked at technology as a solution provider. It didn't work the other way. Okay, so I shouldn't start off by saying that now that I have decided to go digital, now let me look for problems to solve. That's like the proverbial hammer. Like, if you have the proverbial hammer in your hand, then everything looks like a nail. Then you'll try and force fit everything into a digital solution, and that's where you go wrong. Defining the strategy is extremely important. Defining the objective is extremely important. And once you've got that, then you think about technology tools. And when you think of it like that, I don't think it is going to be expensive at all. It's a matter of comparing. What are we comparing it against? Are we comparing it against a known entity, or are we just saying that digital is expensive because somebody told us that you have to have lots of server space, you have to have lots of content creation capabilities, you have to have a huge closed loop marketing platform, and you need to give iPads to all your reps and all that. That doesn't have to be done. That's not the first step, right? There are many small steps that you can take, but identifying the business and then looking for a technology solution is going to be extremely important.
Yeah, that's very good that you answered this question for the smaller companies who think that it might be involving a big investment for them to go into digital. So coming to the next question, Indian pharma has largely followed the West and MNCs, whether it is with regard to products, promotions, and practices, which has actually led to creating a market of full of Me Too products and doctors who are bored with more of the same. And now, how can the Indian pharma deploy digital to create a better engagement and experience using digital in this context?
Right. So I think what pharma has very successfully done, and Indian pharma has done this very very well, is to keep the prices of medicines at rock bottom. The India is probably the only market that comes as close to being a free market in terms of competition, the number of brands that are in there, the number of producers that are in there, the number of options that customers have, and all that. And it's able to kind of successfully ensure that the prices of life-saving medicines are at a rock bottom. Okay, so I think from that perspective, India has been phenomenally successful. We've got great manufacturing capability. Mr. Jain, Sudarshan Jain of IPA always says that it's the pharmacy of the world, and we are setting an example to the rest of the world and all that. I think that's a really really commendable job that the pharmaceutical market has and the Indian pharmaceutical industry has done. Now, this is not a model that they've replicated from the West, because the generic industry in the West is not as powerful as the Indian generic industry, right? What we have replicated is the ability to create innovative molecules at a very, very low cost. So we've understood or we've developed the ability to re-engineer innovative molecules and bring them out at almost the same quality, or at least or comparable quality, and at prices that are unimaginable in the Western world, right? So that's one part that we were able to do. So the product part of it is something that we picked up well, because there is a precedence. We looked at the West, we saw that there are more and more new products coming out, and we were able to kind of bring that model into India in our own way. Unfortunately, what has happened is that has led to a hyper cluttered, hyper competitive, and a huge, a very, very competitive market, which is commoditizing that entire industry, which has commoditized the entire industry, right? So our objective of getting medicines out to the people at very cheap prices has succeeded brilliantly. But what we have missed out over there is our ability to think beyond those medicines. Okay, to create wholesome services, to create a lot of an entire ecosystem. So medicine is not only about pills or syrups and injections. It's a whole ecosystem that should exist to help a sick person, or a patient, to go through the journey of being treated and getting well. Now, pharma unfortunately has kind of focused so much on becoming manufacturers of products that we've entrenched ourselves into a massive red ocean, and currently we are unable to think of ways in which we can break away from these red oceans of commodity and brand and move towards the blue oceans of services and experiences. Okay, so what technology companies are doing is very very counterintuitive, and that's where I find it very fascinating. When I look at the way tech companies are coming, or I wouldn't call them tech companies, but they're healthcare companies which are adopting technology at their core. When they come in, they start to look at solving the problem. They come in with a mindset of solving the problem that exists in the healthcare sector. Now, in the US, healthcare is a $3.5 trillion sector, which is larger than the GDP of India, right? Just the health sector is that large in the United States. Does it make it efficient? No, it is ripe with inefficiencies. And how the biggies of technology, like the Googles, the Facebooks, the Amazons, and all of these, the FAMGA as they are called, why did they get interested in healthcare? Because they saw a large number of problems that remained unsolved. Okay, and they didn't see the incumbent players, the pharma companies, the hospitals, the insurers, the payers, and all that, doing anything to kind of repair those things, or not making life better for their customers. They were actually making it even worse. They were overcomplicating the existing problem, and convoluting it into a really an unsolvable mess. Now that has piqued the interest of people who are interested in solving problems, and that's typically the case that if you see digital health tech companies, these companies that are coming in are operating entirely on a services and a experience model. They don't really focus on the product. So they have the products. It's not that their product doesn't exist, but their product is bundled into a service model. Okay, and why are they thinking about services and why are they thinking about experiences? Because that's the large blue ocean. That's where no one is competing. Now, if Google was to make a pharmaceutical product and enter into the pharmaceutical industry, I don't think they would have been able to compete against the Pfizers, the Mercks, the Novartises, and the Johnson and Johnsons of the world, because innovation is something that pharma has been at for almost 2 centuries now. Right, so coming in there and trying to unseat the incumbents would have been a difficult way. So that I don't look at that red ocean of product and brand, but I start to look at the blue oceans of services and experience. And I play to my strength. I don't come to I don't wrestle with a pig in the mud. I'm not being disrespectful to anybody, but there's that adage that if you wrestle with the pig in the mud, you are playing to the pig's strength, right? So you don't want to do that. So that's what these tech companies are they thought of, right? And they created their own areas. They played to their strength, and their strength is that they were able to leverage technology, or technology platforms are able to create this kind of experiences and engagement models in a far, far, far more efficient and a scalable manner, which is very difficult to do in an offline world. For example, if Google Clinics, Google Clinics is something that anybody can access at any point of time. But if they were to build physical clinics, it would have taken them probably 10 years to get to the scale that they're operating at. The Apple credit card. One of my favorite examples is the Apple credit card that Apple opened up with Goldman Sachs, right? For them to get like 365 million customers in 1 year, Mastercard and Visa would have probably taken decades to get to that number, right? So, and that's the kind of that when I said that technology is a resource liberator, that's what I meant. You with technology, you're able to do scale, you're able to innovate at scale, which is unthinkable, and that's precisely where pharma or India, the Indian pharma companies should try to think of. One of our biggest problems that has existed through my 2.5 decades in the industry and continues even today successfully is that problem of access. And we still operate in the 60% urban and this one with a large 40% of our massive country not having access to healthcare. Right now, this is a problem that pharma has simply not solved. Pharma thinks that government should solve it. Government says private sector should solve it. One or the other, and they are now look at what e-pharmacies are doing, right? And what teleconsultation platforms are doing. They have the ability to scale to such a high extent that they are able to get last mile connectivity through a combination of teleconsultation, which is building up medical consulting platform, consultation and diagnostic platforms, which are reaching down to the last mile, and e-pharmacies which are delivering to the last mile. I think that problem of access is going to get solved very, very easily. It depends upon, of course, there's always the question of, our teleconsultation platforms operating on the ideal bandwidth as in broadband penetration. We know that broadband penetration is pretty high. The cost of data for surfing in India is extremely cheap. It's the cheapest in the world. It costs 26 cents to get 1 GB of data, while it costs you $20 in Switzerland, which is the highest. So there's a massive difference in the cost. That's caused now TikTok is such a huge hit. Given let's ignore the political angle of it, but then when you think about TikTok as a medium, it's got 46 crore people on board, or 44, 45 crore people on board. That's like there was a recent piece of information in the Times of India last month, which said that there are more rural people online than urban people, right? There are 23 crore rural people versus 21 crore urban people, so 10% more rural people. So these are myths that pharma is simply not destroying. One, that rural people, there is no access to internet. Second, they don't want to consume healthcare products, or they don't have the affordability to consume healthcare products. They are not able to understand this language or something like. Each of these things is assiduously being solved and systematically being solved by tech companies, by health companies which are using tech, right? So they've built up the teleconsultation platforms, which is creating health infrastructure. Their e-pharmacies are going down to the last mile to serve. So supply and demand both are getting solved. People are actually paying through innovative models. So no one is asking for upfront payments. They'll bring those customers in and get them to pay subscription model, which is not too heavy. So if it's like 50 rupees a month or something like that, I don't think anybody in rural India will not be able to pay. I mean, of course, you can't go below a certain SEC class, but the bulk of the population really is has an ability to kind of consume healthcare in a way that the incumbent companies never thought about. So I think that's one of the biggest problems. And we have too many myths, and we are not actually spending enough time trying to bust those myths, while the other companies are coming in and simply sweeping away the rug from under our feet.
Yeah, as you rightly said, where the have succeeded is not just providing one service, but then mapping out that particular customer's entire journey. For example, I remember going to place like Gandhinagar in Bangalore to be able to travel to Bangalore, and that's where all the travel agents are there. So you go from one travel agent to the other to see where the best seat is available. So and that was quite a tedious task, but we put up with it. And then Red Bus came up,
Mm.
and they put all the 20 bus operators in one place, and you could at one click say, I want to travel between 3 o'clock and 5 o'clock, which is the best seat available. And you really knew whether you needed to go to these 20 operators, and they removed the pain point of the traveler.
Exactly.
And in the same way, when you book an air ticket on Make My Trip at 5 o'clock, you know that there used to be a time when there was a problem of getting Ola cabs before the Ola cabs came in. So they would send a message and saying, we have a tie up with Cell Cabs and he will come and pick you up at 5 o'clock. So they were actually mapping the entire consumer's journey from the time he decides to leave his home to go to another place, whether it was a cab that was required, whether that was a hotel room that was required, that's another services that's required.
Mm.
So I think the importance of mapping the patient's journey, and just look at even in the COVID crisis, now I'm reading of stories of patients going to 7, 8 hospitals in search of a bed. I mean, what rocket science does it take to create a map of an app of all the hospitals and saying which is the nearest hospital to me and where is the bed available? And I think these are the areas of collaboration, even not only in this crisis, even going forward. So if a company is there in a particular therapy area like oncology, and then they are able to bring all the players of oncology and the services that are available, and how a patient can go on that app and even give authentic information instead of telling patients don't search it. So what are your thoughts on creating this ecosystems? Where is pharma, and how is the way forward, so that a patient is pulled into the system where just like I as a traveler have experienced the benefit of Red Bus or a Make My Trip. Where is the way forward, and is there any activity happening in that space?
See, something as simple as what has pharma always focused on? Pharma has focused on doctors. Okay, the more they are able to serve doctors, the more they are able to get their business. And what is the biggest way in which they can serve doctors is by putting more footfalls into the doctors' clinics, right? By popularizing their practice, or not promoting them per se, but then helping doctors or patients to find doctors. Now, can you think of one pharma company that created a doctor locator app or used technology to help people to go into the right doctor's clinic? Not one. The guys who created doctor locators were things like guys like Practo and some of the other tech companies which came in. So this is taking extending my previous point about how technology companies look to solve problems while pharma simply focuses on promoting products. Right. So pharma's way of doing or bringing in patient footfalls into doctors' clinics would probably be by doing diagnostic camps, or doing patient screening camps. This is such a tired old idea, that you have to essentially physically go to some place and get something done. I think technology has done away with that concept of time and distance. No one needs to go anywhere to get anything done. I don't need to go to a bank to do a financial transaction. You don't need to go to Gandhinagar to book a bus ticket. You don't need to go to a hotel to finalize a room, right? All of it is done in the convenience of your home. And I think that's exactly the pain points that these industries have solved. Banks realized that coming and standing in long queues was a pain point for customers. They removed that pain point. They used technology to remove the pain point. They created ATMs. They created a whole ecosystem of services which you can access through an app. And everything that you need to do about regarding your money is essentially something that you can do at the tap of an app, right? Now, if did banks think whether people would really trust an online application to with their money, and would they have had those doubts? I'm sure they did. Yeah, when they were building it, there would have been naysayers in the banking industry also who would have said, "Are you mad? Would you do you think that somebody will buy an FD without actually knowing the whole every terms and conditions and all those things? It's not going to be possible." So But the fact is that they persisted. They realized that these were pain points. And today, if you look at the way banking happens, I mean, did banking, did those digital transformation journey in banks actually cause banks to lose jobs? Were people unemployed because of that? To the contrary, it actually improved, right? The whole banking sector went private. It went out of nationalization, and then lots of private banks that came up and they used technology. And today there are probably 40-50% more jobs in the banking industry than ever before. Those are some of the we are probably at those points where we are thinking about, oh, if I use technology, there are too many vested interests, there are so many people who are employed in the Indian organizations, and they may all lose their jobs. Are we actually creating a situation whereby we might cause an unemployment? How will we deal with the unions? If I send my medicines to patients directly over the internet through e-commerce models, what will AIOCD say? Am I able to take on these large unionized organizations and all that? I mean, you look at history, every industry has gone past these. Uber, for example, has taken on the taxi unions, head on. And what has happened is the kind of value that they've created, not just Uber, but many other transport companies, right? So there are examples in industries for each of these points. Wherever there has been a pain point for one of their customers, they have simply deployed technology to remove that pain point. As the industry operated differently, no, it's still about money. The banking industry is still about money. I put my money into the bank pays me a credit for that. I take a loan from the bank, I pay credit to the bank. That's how both of us exist, and we cooperate, right? But none of us really have to go to the bank, or the bank doesn't have to come to my house to get it done. All of us can do that online. The bank continues with its business. I continue with my life as in a normal way. So I think two very important things is, one is to understand a customer's journey in such a way that you are able to identify the pain points and bring technological solutions to ease the pain point. The second part is that, Peter Drucker very famously said that marketing should not feel like marketing. The best kind of marketing should not feel like marketing. And if you're constantly pressurizing your customer to change his behavior or to do something against his will, the customer is likely to resent, or to resist you. So you're not likely to buy from a guy who continuously says, please buy, please buy, please buy, please buy. But you are likely to listen to somebody who says that, this is how my life improved, and a friend of mine saying that, I bought this television, and oh so great, it was so easy to do this deal over Amazon के ऐप पे मैंने क्लिक किया, वहीं पे पेमेंट हो गया, वहीं से माल आ गया. पहला जो टीवी आया वो ठीक से नहीं चल रहा था, so I could do an easy refund. I could return the goods and all. So those pain points, once I understand that it's easy for me to do this transaction, it's safe for me to do this transaction, more and more people come on board, right? It's, if you look at the Google set of products, if you look at one product versus the other, you would never be able to actually understand the link between this. So why would a search engine company need to build home appliances, home security appliances? Why would a search engine company need to create a camera, a duo, where you have an instant conversation like this? Why is that required? Why do I need a podcast app? Why do I need something else? But if you look at it from the customer side, it's the lifetime in a day. What all activities do I do? Google has positioned their products according to that. I get up in the morning, I need an alarm, so I've got Google Duo. I've got Google Home, right? Then I get up, I want to check my news and all that. I've got a phone, so Google's got a phone for me, or it's got an operating system. I go for a walk, or I go and do my exercise. At that time, I want to listen to music, or I want to listen to podcasts or something. Google's got a product there. After that, I come back home and I go to work. When I go to work, I want my home to be secure. I've got home security. Then I want to, when I'm going to work, I want to get the best possible route, the most easiest route to reach my workplace. So I've got maps. When I go to work, I need a whole suite of business activities. So I've got a whole suite of business activities. After that, I want entertainment. I want to connect with my friends. I want to create memories. I want to have meet them for parties or something like that. They've got a whole set of products over there, and then I come back and I sleep. So it completes my whole day. And if you look at it from the customer's perspective, from the eyes of the customer, every part of Google's product portfolio makes sense to you. But if you look at it from outside, it makes no sense at all. So that's what a successful organization does. It does not believe that my business model is to only create medicines. My business model is to make sure that my people, my patients, improve their health outcomes. and everything that I can do to make sure that their health outcomes are improved are products that come into my commercial interest zone. Right. So whether it is a wearable, whether it is a medical insurance, whether it is a doctor locator, whether it is a bed finder, whether it is a doctor-patient interaction platform, whether it is an e-pharmacy, whether it is an insurance cover that I require, or I need wellness, or I need gym membership, etc., etc. All of those should ideally come under the pharma domain, because pharma should be essentially thinking about the patient.
Patient.
Okay, and when I say that my job is only to make medicines and nothing else, then there are other companies that will come in, use technology, create these whole ecosystem of products and services, which essentially patients will find very convenient. Patients will migrate en masse to those platforms, and then the bargaining power shifts before you even know it. Right? If there are some ecosystems like this, if Google and Amazon were to create two ecosystems, just for the ease of argument, if Google had like 50 crore people and Amazon had 50 crore people, imagine the kind of bargaining power that these companies will have. They will go to pharma and say, look, boss, we've got 50 crore people who need medicines, right? So you give it to us, but at our cost. And our cost is cost of your production plus 1 paisa. That's it. So if pharma companies think that NLEM is going to be a problem for them, they don't know what's coming. And the quicker that they start to think about this from a broader perspective, about not thinking only about patient discovery when the patient gets my brand prescribed. Currently in my patient flow, the only time I start to think of intervention is when somebody comes onto my brand. Okay, that's the time that I have commercial interest. Otherwise, I don't. So you need to broaden your horizon, think about how I can serve the patient, probably at a time when he's not even returning any money on your investment. So you invest in that person, but you broaden the customer lifetime value. There are a lot of things that pharma can do if only it starts thinking differently. You start thinking about the patient, you start thinking about pain points, and automatically an ecosystem will come. You will start creating an ecosystem.
So that's been very interesting and enlightening to know that how other industries have mapped their customers' journey and understood their real pain points and provided solutions which has made life easier for the customers, whether it is their daily activity, monthly activity, or even along their life's journey, like as in banks and insurances have made it easy. I think pharma has to go beyond the pill as we popularly talk it, and beyond the physician, and focus on the patient, who probably has the largest number of problems and pain points, which incidentally are the opportunities for pharma. So instead of looking at only the pill as the only solution to the patient's problem, they have to look at his entire journey from the time he discovers his symptoms to then being able to manage his condition in a way that brings him satisfaction. So digital offers all these opportunities, and it's been a great pleasure talking to you, Salil. I look forward to your session in one of the coming Fridays again, and then follow it up with discussions. And I hope we will be able to bring in more pharma industry professionals where we can discuss some of these challenges of that pharma faces in adopting digital. So as you rightly said in the beginning, Indian pharma has done a wonderful job in making India as the pharmacy of the world, and I think it has to take some steps now to to remain relevant. It has to not just make incremental changes, but look at the world around and how things are being changed by technology, and take some of those steps to reinvent itself, because health will always remain very important to people. As long as human beings are there, there will be a need for health. So thank you for this time that you have had with us. I hope our participants have had a good time, and if there are any questions, feel free to ask them in the Digital Academy Digital Excellence Pharma Academy discussion box, and we'll be glad to answer those questions. So thank you, Salil. Thank you, CredoWeb, and thank you all the participants. Good evening to you all.
Thank you. Thank you for having me, Anup. Thanks.